So today the infection I chose to cover was Campylobacteriosis, or the disease associated with a Campylobacter infection. So what is Campylobacteriosis? Well, essentially it is a disease resulting from a Campylobacter infection, which is a food and waterborne spirochete parasitic bacteria. And it is an extremely common disease affecting 20 out of every 100,000 people just in the United States alone, with approximately 1.5 million cases per year in the United States alone. It is the cause of 1 in 4 cases of diarrheal disease globally, making it the most common cause of diarrheal disease. And that's across the entire world, although the incidence rates vary from country to country. Now, in the infected populations, anyone potentially can contract Campylobacteriosis or become infected with the Campylobacter parasite and be asymptomatic. But the ones that are most at risk are going to be men, as more males and females contract it every year. Also, the children and the elderly are also more susceptible. The immunocompromised also are at risk of contracting this disease, as well as those with AIDS, pregnant women, and the elderly. The immunocompromised being especially susceptible to the complications associated with Campylobacteriosis. Now, the symptoms. The most common symptom is diarrhea, often bloody. There is also followed by potential nausea and vomiting, as well as fever and cramps of the stomach area. There are several complications that can occur from this infection, most notably temporary paralysis, irritable bowel syndrome, and arthritis, although we will get into specifically why in a little bit. The symptoms will usually occur 2 to 5 days after infection and last anywhere from 3 days to 6 days, with an incubation period of 1 to 7 days, making this one of the longest incubation periods of a bacterial infection. And if the bacteria happen to migrate through the intestinal wall, it can cause a bacteremia in which the bacteria will begin to infect the bloodstream of the host. Now, the modes of transmission. It is primarily spread through contaminated drinking water and undercooked food, as if water comes into contact with any of the Campylobacter bacteria or comes into contact with infected fecal matter, then the water and food is now contaminated. Primarily, though, undercooked food, and most notably poultry, is the primary means that this bacteria is spread, as it can survive and incubate in the intestinal tract of, say, chickens or turkeys. But when the animal is slaughtered, the meat now it becomes contaminated with the Campylobacter. Milk also can spread this disease, as if the udder of the cow had contaminated fecal matter on it, or the milk was not pasteurized, then the milk can now be a vector of transmission. But the primary way that the infection spreads is if a host comes in contact with contaminated fecal matter, such as the drinking water, or if an animal happens to consume food that has been infected with fecal matter, then it can become a carrier for the Campylobacter infection. Animals are the primary carriers of this disease and can remain asymptomatic until the animal is slaughtered, with the animals rarely showing any signs of disease. Cross-contamination also is a primary cause of this disease, as if cooked food is prepared in the same area as undercooked food, then the cooked food will now become contaminated. Now, the strains of this disease. There are 17 species and 6 subspecies of Campylobacter, but the most common are C. jejuni and C. coli, with these being the most common bacteria found in Campylobacteriosis infections. Essentially, these are the most common causes of Campylobacteriosis. Now, how this bacteria actually works is once you ingest it, it will adhere to the intestinal epithelium and the mucus layer on the inside of the intestine. But if it happens to migrate through the intestinal wall, it can infect the lymphatic system and get into the bloodstream via the lymphatic system. There were 2 postulated mechanisms as to how the bacteria actually causes the disease. The first being that it will change the fluid recollection rate of the intestine, causing the diarrhea, or that the toxins that the bacteria produce will cause inflammation of the bacterial wall or an inflammatory enteritis, which will also cause the intestinal wall to start shedding itself, which leads to the bloody diarrhea. However, a very rare side effect can be Guillain-Barré syndrome, which leads to numbness and paralysis, which occurs through ganglioside mimicry. Now, what this is molecular mimicry between Leo oligosaccharide, a component of the cell envelope of Campylobacter, and sugars on nerve gangliosides. The antibodies created while fighting the infection containing these ganglioside mimics can cross-react with gangliosides in some individuals. Now, the rate of this happening seems to be dependent on the individual, and thus it is linked to genetics, but it is not well understood. Which this cross-reaction can lead to demyelinization of nerves and the degeneration of axons as the body begins attacking the nerves in an autoimmune response, reacting to the myelin sheath as it would to the Campylobacter infection. Although this condition is very rare, occurring in only 1 in every 1,000 infected individuals and occurring several weeks after infection, which means that this can go undetected for long enough for it to be not associated with the diarrhea if the person does not recognize that they had a Campylobacteriosis infection. And this specialized bacteremia only affects about 1.5 to 8 in every 1,000 affected individuals. But Campylobacteriosis is extremely infectious, requiring only 500 to 800 CFU in order to infect and cause disease. Unfortunately, in recent years, the Campylobacter bacteria have begun exhibiting antibiotic resistance, as the use of antibiotics to treat foodborne disease will lead to increased bacterial resistance. Most notably, resistance to ciprofloxacin increased from 17% in 1997 through 1999 to 27% in 2015 to 2017. And another notable antibiotic used to commonly treat Campylobacteriosis, fluoroquinolones, were used heavily during poultry outbreaks. And the use of fluoroquinolones in poultry outbreaks led to an increase in fluoroquinolone-resistant Campylobacter infections, which can survive and multiply in poultry as well as the drug-susceptible bacteria. And Campylobacter bacteria have been known to exchange genes between strains before. What the CDC has done to prevent this is they have begun tracking antibiotic resistance among bacterial isolates from infected individuals or those who suffer from the disease. But the best way to counteract Campylobacteriosis is to prevent it outright. However, the disease often goes undocumented, as many of its symptoms are just associated with normal food poisoning, and the symptoms disappear in a few days without needing treatment. Thus, it often goes unreported, and no one really goes to the hospital for it unless it's extremely severe. But the symptoms are usually mild and only last a few days. But the best way to diagnose this infection is to conduct a stool sample and to check the stool sample for Campylobacter. However, the innate and adaptive immune response is usually the best way to treat this infection, as the body's own defenses can usually clear out the infection before it becomes too severe, and thus antimicrobials are not needed in most cases. But in severe cases such as a bacteremia or an infection of the lymphatic system, antimicrobials are required. But the best way to prevent this infection is with safe handling of food and upkeep of safety standards, as most often Campylobacter can be killed off via cooking of food, or it can be gotten rid of by simply washing the work surfaces or washing the hands of the individuals preparing the food. Thus, the bacteria is extremely preventable, but in developing countries, it is more of a threat. And most antibiotic resistance has been seen with those who contracted it while traveling to a foreign country. But thank you for your time.